Hello, and welcome to the Patient Healthcare Record Training. I am Melissa Thiel-Collar, the district's in-house legal counsel. Today's training will provide you with an understanding of patient healthcare records and provide you with the necessary background information in order to implement and understand the student record organization and confidentiality process. This is phase 2 of our reorganization of student cumulative files. If you have any additional questions during the duration of this training or any time thereafter, please do not hesitate to contact me at the information listed here. You may also contact your district nurse. There are 4 pieces of information that may help you during the course of this training. These documents were included in links attached to the email. They are Patient Healthcare Record Procedures Table, a Medical Record Access Form, an IEP confidentiality quarter sheet form, and a student record access log. So why are we continuing with the reorganization of our student cumulative files? This is a continuous process as we continue to examine the confidentiality and records retention of our student cumulative files. We need to continue to evaluate whether we are providing the highest level of confidentiality and security to our students' records. As you may know, we started this process in the summer of 2013 with the reorganization of students' cumulative files, the relocation of the elementary cumulative files to a central location in locked file cabinets, and the implementation of the retention schedule for documents and files when students leave our system. Up until this point, there has been no centralized system for the requesting, receiving, and storage of patient healthcare records. The law places a higher confidentiality requirements on patient healthcare records. There are different record retention requirements for these records, different redisclosure requirements. In the Green Bay Area Public Schools, patient healthcare records are currently maintained by social workers, psychologists, nurses, and in the students' cumulative files. There is no system to place, receive, retain, and destroy the records. So before we begin, let's understand what is a patient healthcare record. The statutory definition provides that a record is that any pupil record that relates to a student's physical health and that is not a pupil health record should be treated as a patient health record under Wisconsin statutes. This definition is not very helpful in determining what is a patient health record and what is a pupil health record. Let's look at what is a pupil healthcare record. These include immunization records, which are also progress records and maintained in the green progress record folder, an emergency card, a log of first aid and medicine administered, an athletic permit card, a record concerning the ability to participate in an education program. This typically includes notes from doctors excusing students from Phy Ed class, a lead screening result, or results of routine screening tests such as those for hearing, vision, and scoliosis. Now that we know what a pupil physical healthcare record, let's talk about what is a patient healthcare record. Again, this is defined in Wisconsin statute. It includes all records that relate to the health of a patient prepared by or under the supervision of a healthcare provider. What does this mean? If a record is not a pupil physical health record, as we just discussed, and the record relates to the student's health and is prepared by or under the supervision of a healthcare provider, it is a patient healthcare record. Examples of patient healthcare records include a medical opinion, diagnosis or judgment, generally a report about a child from a healthcare provider outside of the school, such as from the child's treating physician or mental health care provider, records of any conversations with physicians or other healthcare providers, a summary of evaluation reports written by healthcare providers in the school that discuss a student's health or medical history, Medicaid documentation, nursing diagnosis, medical orders, or medical or health reports from healthcare providers. It's important to pause and understand that it is the content of the record that determines its category, not the title of the record. If a medical opinion, diagnosis, or judgment is contained within a document, such as an individual health plan, an IEP, or a 504 plan, that part of the record becomes a patient health care record. Patient healthcare records must be treated differently than other student records because of a higher level of confidentiality for patient healthcare records. Records may only be viewed for purposes of educational programming and services, medical evaluation, and treatment and health assessment and planning. In some cases, HIPAA provisions apply if the school is directly billing Medicaid. For some of our students, this is the case. Different redisclosure requirements apply to patient healthcare records and are much more limited. There must be a separate process for the transferring of patient healthcare records to another school district, and a record of access to the patient healthcare records must be maintained by those who access the documents. Parents must be given a statement of who has access to their child's patient healthcare information when requested. Please know that there are significant penalties in the law for unauthorized disclosures as well as fines for unintentional disclosures. So when may a patient healthcare record be requested? Records may only be requested for purposes of educational programming and services, medical evaluation and treatment, and health assessment and planning. There must be a proper authorization on file prior to requesting these records. In the Green Bay School District, this is typically the M14 form. Those who may request patient healthcare records include building administrators, school healthcare providers. This generally includes nurses, physical therapists, dietitians, athletic trainers, occupational therapists, speech and language pathologists. In the Green Bay School District, the only school healthcare providers are our nurses. Pupil services staff may also request patient healthcare records, which include social workers, school counselors, psychologists, program support teachers. Those individuals who may receive patient healthcare records include building administrators, nurses, pupil services staff, and clerical staff may process and maintain patient healthcare records. If a patient healthcare record is provided to an individual that is not the approved receiver, or for whom there is no educational programming or service interest, the record must be given to a building's pupil services team member, and the individual who has given the record should note when the record was provided and by whom the record was provided on the document log in the patient healthcare folder. If an agency or medical provider provides patient healthcare records to the district, a release should accompany the records. This release could be the agency or medical provider's release or the district's M14 form. If no release is included in the records, the pupil services team member should request a release from the agency or provider. The release should be filed with the records in a confidential patient healthcare record folder. Now that we know who may request and receive patient healthcare records, let's talk about who may review patient healthcare records. A building administrator, school healthcare providers such as the nurses, or pupil services staff including social workers, school counselors, psychologists, program support teachers, and certified staff who have a legitimate purpose may review patient healthcare records. Patient healthcare records must be maintained in a location other than pupil records. Due to the heightened confidentiality and redisclosure requirements for patient healthcare records, these records cannot be maintained with other student records. In the Green Bay Area Public School District, patient healthcare records will be stored in a separate orange file, in a separate file cabinet or file drawer marked Confidential Patient Healthcare Records. There is one exception to this rule, and that's for IEPs. If an IEP includes patient healthcare record information, it will continue to be retained in the behavioral file and the cumulative file, which are the yellow folders. IEPs that contain patient healthcare information will have attached by a special education staff person an IEP confidentiality form. You were provided this form in one of the links to this presentation. This is a sample of what the confidentiality form will look like. It will be a quarter sheet attached to the front of an IEP in the behavioral file attached to the IEP. How will staff know that other patient healthcare records exist? When a patient healthcare record is received, it must be filed in the confidential patient healthcare file. To notify staff that the record exists, a notification form will be placed in the student's physical health file, the red file, and the cumulative file by the individual receiving the record. You were provided a copy of this form in the links for today's presentation. This is a medical record access form, which will be filled out by the individual who receives the patient healthcare record to be placed in the pupil physical health file, which is the red file in the cumulative file. Let's talk about what will be placed in a student's patient healthcare record. M14s and releases that correspond to the patient healthcare record should be placed in the orange patient healthcare record file. However, these are the only M14s that should be placed in the patient healthcare record file. All other M14s should continue to be placed in the cumulative file, the manila colored folder in the front of the folder. They should not be relocated to the patient healthcare record file. Only those M14s that correspond to the patient healthcare record should be placed in the patient healthcare record file. Any questions on this, please do not hesitate to contact me. In addition, all records related to the health of a patient prepared by or under the supervision of a healthcare provider, self-harm forms and reports, medical opinions, medical diagnosis, or medical judgments will be placed in the patient healthcare record file. Again, it is not the actual name of the document that determines whether the document will be placed in this file. It is the content of the document that determines whether it should be placed in the patient healthcare record file. So what happens when a patient healthcare record is received in the schools? Upon receipt, the appropriate staff person should review the report. This will typically be a pupil services staff person or the nurse. Based upon information in the report, the staff person may determine to prepare a report to be shared with other school staff with a legitimate interest. If the school report is limited to information about how the child's health affects participation and performance in the educational program and other basic pupil physical health record information, the report may be treated as a physical health record and placed in the red folder in the cumulative file. However, if the patient healthcare record is to be retained, it should be filed in the confidential patient healthcare record file. The process for accessing patient healthcare records will include the following. For individuals who have an educational programming or service purpose, or medical evaluation or treatment or health assessment or planning interest, patient healthcare records may be accessed. When accessing patient healthcare records, the student record access log must be completed in full each time. This record access log will be included in the confidential patient healthcare record file. Records must be reviewed in a confidential setting. A copy of the example of the patient healthcare record log access form has been provided to you prior to today's training. This is an example of what it will look like in the files. As previously noted, patient healthcare records have a different record retention period than other pupil records. Patient healthcare records must be maintained for 5 years after the student leaves the system. However, if the document was not requested by the district and is a duplicate document from an outside healthcare provider, it does not need to be retained. Notice should be given to the individual providing the document that it will not be retained by the district. Please work with your pupil services staff in determining whether the document may not be retained. In certain circumstances, patient healthcare records may be destroyed. A parent or legal guardian may request for the document to be destroyed. If the document was not requested by the district and is not the original document, it may be destroyed. If the document was not requested by the district and no release was provided authorizing the document to be given to the district, the document may be destroyed. Any destruction must be consistent with the district's record retention schedule, and under FERPA, no records may be destroyed while a parent's written request to review and inspect the records is pending. Please work with your pupil services staff in determining whether records may be destroyed. As with destruction of records, in certain limited circumstances, patient healthcare records may be redisclosed. Redisclosure is permitted only if an informed consent or court order is received, or the redisclosure is limited to the same purpose of the original disclosure. In certain circumstances, patient health care records may be transferred to another school district when a student transfers. Patient health care records that originate in the school may be transferred. It is permissible to transfer community mental health and AOD treatment records. Informed consent must be obtained to transfer patient health care records that originate outside of the school. In order to transfer records, once the consent is provided, patient health care records should be sealed in a separate envelope from the student's other pupil records. The records should be sent to the new school with the instructions that they are to be accessed only by a healthcare provider or person acting under the supervision of a healthcare provider. So what are our next steps? You should have received your materials for reorganizing patient healthcare records. These materials include the orange patient healthcare record folders, file labels, and in certain limited circumstances where principals ordered additional file cabinets, those should have been received. Not every student will need a confidential patient healthcare record file. Only those students who have patient healthcare records will need a file. Once this training has been completed, clericals should begin to review students' cumulative files and remove any patient healthcare records from the files to be placed in the orange confidential patient healthcare record file. In reviewing cumulative files, duplicate copies of patient healthcare records may be destroyed so long as the documents are the exact same document. No other documents should be destroyed. The new files will be stored in a separate file drawer or cabinet labeled Confidential Patient Healthcare Records. Once the files are made, please notify your pupil services staff and nurses so that patient healthcare records that they have may be placed in the new confidential files. Pupil services staff and nurses will be placing patient healthcare records in their possession in the confidential patient healthcare record files. The new files should be completed by April 2015. An audit of confidential patient healthcare record files and cumulative files will be completed in May of 2015. If you have any additional questions during this process, please do not hesitate to contact me at the information listed here, or please contact your district nurse. Thank you for working to make sure that our students' records are confidential and retained in the manner they must be retained.